Welcome to our instructional video provided as part of the Theatre Nursing Masterclass. We're going to demonstrate two types of skin closure, starting with a non-absorbable suture. First of all, you need to mount your needle correctly if not already done for you by the scrub nurse. So grab the needle 1/3 of the way along from the suture end in the tip of your needle holder. The suture packet's designed to allow for this. There's a flattened area on the needle itself designed to accommodate the needle holder, and this should stop the needle twisting around in the holder and won't damage the needle. At no point should you handle the needle with your fingers and be continuously aware of the potential for a needle stick injury to yourself and others. Hold the forceps by the grips and use them to gently expose the skin edge. You can identify the epidermis and dermis and subcutaneous layer below. Starting in the centre of a long wound for interrupted sutures, insert the needle at 90 degrees to the skin surface and using a twisting action, allow the curvature of the needle to pass through the skin and out of the subcutaneous layer as demonstrated. The depth of tissue should correspond to the distance between the wound edge and the needle insertion point. Grab the needle with your forceps and remount the needle as shown. Directly opposite, follow the same principle in reverse, to pass the needle from within the same subcutaneous layer and out of the skin, ensuring an equal depth of tissue is collected and the needle exits at an equal distance from the wound edge at 90 degrees. Tie the knot at one side of the wound by wrapping the proximal end of the suture twice clockwise around the needle holder as demonstrated, and then once anti-clockwise. Easing the knot down onto the skin. Complete the knot by wrapping the proximal end of the suture once more clockwise around the needle holder and down onto the skin, taking care not to over-tighten and strangulate the tissues. Take extra care with the free end containing the needle during knot tying. Cut the suture with enough length to allow for removal. Start the next interrupted suture halfway between your previous stitch and the end of the wound in order to bring the edges neatly together and allow placement of each stitch to be equidistant and tension equal along the entire wound.